The only way to hurt the human body is to not use it. Hi, I'm Dr. Jack LaLanne, author of Lose Fat Forever, the Bermuda Triangle Diet, host of Live It For Now, and contributor for USA Today. And I've been on a little bit of a Jack LaLanne kick. Now, maybe I'm going back in time and thinking old school about this whole thing, but some of the things that Jack LaLanne said in the 1930s, 40s, 50s, 60s, and beyond still hold true for today. And I think it's important right now because of what's going on. In New York State, which is where I am and where I run a practice, gyms are closed in New York State right now, so you can't go to an open gym and exercise. And a lot of people feel restricted. A lot of people feel they can't work on their health and fitness, which is true. And because of it, it discourages people. And it's hard to hear that. And I don't like hearing that because your health and your fitness are everything. It's what will improve your metabolism. It's going to improve your health. There's a lot you could do if you take it into your own hands. And any type of thing that's going to distract it makes it more difficult. Now, of course, I understand that New York State is battling with COVID-19. They're battling with infections and contraction. And in the process of doing so, they're trying to make calculated moves of how and why and what they can do to stem the spread of it. I understand all of those things. But individually, I'm going to encourage everybody to do their part to take advantage of it. Now, when it comes to the human body, several things, and Jack LaLanne was absolutely right. If you don't do the right things, if you don't exercise, if you don't work your muscles, what happens? They atrophy. You get weaker, your immune system gets weaker, your circulatory system gets weaker, your heart and your lungs. You know, I talk about muscles all the time. Cardiac pulmonary muscle is muscle number one. It's primary. And if you're not using it, it's going to get weaker and weaker, and that's not going to help your long-term health. When it comes to nutrition, same type of thing. When you're eating properly, it's going to improve you. When you're not, it's going to distract and hurt you. And when you combine those things together of lack of the exercise and then also poor nutrition, bad outcomes happen, which is exactly what we're trying to prevent right now. The number one thing that the state is trying to prevent is COVID-19 and hospitalizations from it, which is extremely relevant and super important. And by all means, take note of that because you should pay attention to it. On the other hand is what comes after that, and that is the rest of your life. That is your energy, your well-being. It is your mindset. It's the quality of your life. It's being able to move, get up off the floor, play with kids, play with grandkids, be around, have less medications and less doctor's visits, less drugs in your life. Blood pressure, blood sugar, diabetes, obesity, heart disease, thyroid disorder, a lot of those are totally within your control if you do the right things. Which is why I once again wanted to reflect a little bit just on Jack LaLanne. I met Jack LaLanne in the late 1990s. I was at a health and fitness convention for my certification, which is the National Strength and Conditioning Association, and he was a keynote speaker. And after the event, he took the time to shake everybody's hands and do a little bit of a meet and greet. He already at that point was in his late 80s. He shook my hand in a way in which it wasn't right for weeks, if not months afterwards. He had so much tensile strength, and this wasn't a big guy. Yes, he had some bigger muscles, but he wasn't a big guy. He probably stood all of 5'6", maybe 5'7", but the grip strength that he had even into his late 80s was impressive to say the least. A guy that frequently swam between San Francisco and Alcatraz, dragging boats with people in it, and he continued those feats into his 60s and did his last one even as old as 75 years of age. Worked out at least an hour to two every day of his life. I'm not saying that you have to do that. That is excessive, and you would have to be a fitness enthusiast in order to pull that off. But it was somebody that took it extremely seriously. And the last thing he said is your bank account, your health account, the same thing. The more you put into it, the more you can take out of it. I'm Dr. Jack LaLanne asking you to make the most of your life and live it fit.